Hello, good afternoon. This is Dr. Velma Scantlebury, and I am here from Dialysis Patient Citizens Educational Center, bringing you Ask the Doctor afternoon here on Facebook. Again, this is Dr. Velma Scantlebury, and this is our live session for Ask the Doctor. So, good afternoon. Again, hi Joanne, this is Dr. Scantlebury. I am here with DPC. I am the medical consultant, and I hope you guys are prepared to ask some good questions. Remember, this is February. We're still in February, and this is Heart Disease Month. So we're probably going to talk about things healthy as far as when it comes to your heart and how to avoid being admitted for heart disease. We know that heart disease is the number one cause of death with kidney disease when it comes to end-stage kidney disease, as well as those on dialysis, as well as even after transplantation. So, unfortunately, it's important to get your heart checked. It's important to, even if we're not with kidney disease, it's important to understand whether or not you are at risk for kidney disease and whether you're at risk for heart disease, because sometimes one goes in line with the other. And why is that? Because when we look at the two leading causes of end-stage kidney disease, which are high blood pressure and diabetes, both of those will lead to significant heart disease. And so it becomes important to always have your heart checked from these two leading causes. And fortunately for many patients, long-term hypertension increases the size of the heart, and you get what's called hypertrophy of the heart muscles. And for many patients, they can get coronary artery disease as a result of underlying heart disease. So when you go on dialysis, one of the things that complicates dialysis is high phosphorus levels and calcium phosphorus imbalance, which leads to more deposition of plaque within your arteries, leading to more heart disease issues, and as well as when it comes to vessel disease. And for many patients, it's important to understand what your risks are. And when you think about question, thank you, Joanne, what do you mean? Talk about what an enlarged heart means. So just think of your heart as it is a big muscle. And so your heart's pumping at a certain number of beats per minute. And just imagine if you have high blood pressure, then you're increasing the pumpability of that heart. So what happens with anything that's where muscles are forced to work harder, like when we work out and we want to build muscles and make our muscles stronger, they can often get bigger. If you're a runner or a skater or someone who's using those muscles are going to get very firm and tense. And so sometimes just imagine if your pressure is high all the time, then it's going to cause the heart to be working harder. And so the muscles of the heart will enlarge, and what that can do, but it doesn't necessarily increase the cavity of the heart. And so the cavity may be still the smaller size because now the muscles are bigger. And so you can have enlarged heart where you have left ventricular hypertrophy. Hypertrophy does mean enlargement of the muscles. And so now you have an enlarged heart. You can also have an enlarged heart because when we call it cardiomyopathy, because now your heart has lost pumpability because it has been stretched to a larger volume than it need to be, such as if you're constantly gaining weight on dialysis and that excess weight that is not able to come off with diuretics or dialysis, frequent dialysis treatments, now you're holding on to that extra 5 kilos, 10 kilos of extra weight, and that balloons your heart. So just imagine if your heart like a balloon, and every time you blow it up with the extra weight gain with dialysis, you stretch it. And so it becomes more stretched out and less compliant. And so you get a cardiomyopathy because now it has no ability, those muscles have lost the ability to pump as well as they could. And then you have an enlarged heart because of lack of ability to tighten down those muscles and get that extra, get your pump that volume through to the rest of your body. So those are two conditions where your heart is enlarged, one because of overdilation, and the other part because now your heart's enlarged because you have very large thickened muscles, which can also occur with deposition, such as with amyloid in terms of depositing into the heart muscles. So it becomes important to watch your volumes, make sure if you're on dialysis that you are controlling, if you're on hemodialysis in particular, in-center dialysis, that you are controlling your volume gains so that you are not putting your heart at rest. And so it's knowing that you have minimum, if you are at that point where you're not having a lot of urine out, you're not making any urine, or you're making less than a cup a day, but you're drinking much more than that. Just imagine, where is all that fluid going? It's going to be accumulating in your body until you can take it out. So Nancy's question is, when you're on dialysis, you have to restrict your fluids. And if you don't restrict those fluids and you aren't urinating anymore, then you're holding on to that extra volume. For some people, that extra fluid can go in your tissues. You can have more edema or swelling in your legs. For many people, it can be around the waist or the lower part of the body. And for others, it could be in the lungs where you have trouble breathing. And so you can't lay flat. You get short of breath, and you pant because your body cannot take on that extra volume that comes off when you then undergo your dialysis treatment. So it's very important not to put your body, your heart at risk, because if you're holding on to that extra 12, 15 pounds or kilos, then that is, and your heart's already compromised from having an enlarged heart, you may then put your heart into congestive heart failure, because now you have extra volume and your heart is tired. It's saying, I can't move this volume. That volume that's trying to get through your heart from your lungs stays in your lungs, builds up, cause you to have trouble breathing, and you have to be admitted to undergo IV diuretics to try to move that volume, or even to undergo dialysis to take off that extra volume. So great question. Thank you all for logging on. Again, I'm Dr. Scantlebury. I am your medical consultant, and this is your monthly Facebook where you can ask me all kinds of questions. So thank you, Antoine, Raymond, Enid, thank you for coming on, Tanya, and I'm glad to see you guys here today. It's important to continue to keep yourself healthy. And even after you have a transplant, we want to make sure that you are constantly undergoing, being seen by cardiology, having your heart monitored, making sure you're not at risk for progressive heart disease. What may be some of the reasons why a patient has constant diarrhea? Could it be medication, diet? Definitely. I recently lost a family member who stopped going to treatment because he kept having diarrhea during treatment. Of course, he had excess fluid and then cardiac arrest. He was encouraged to talk to his doctor, the center, and staff. Certainly in terms of loose stool, and if you're having diarrhea, most loose stool, you may be having a more volume out. And so it becomes an issue of what's causing it. So you always look at medications to see whether it's something you are eating or that you're taking in. You may have an allergy, may be glucose intolerant, you may be something to do with dairy products, or you may have food poisoning. If it's constantly all the time, you want to look at whether it can be, if it's not food and it's not medications, is it irritable bowel disease? Is it that certainly you may be taking too much magnesium? Something like that can oftentimes give you a loose stool. But you also want to make sure that you're not dealing with some kind of gastrointestinal neuropathy. As oftentimes you see many patients who may have long-term diabetes, especially if it's type 1 or type 1.5 or type 2 for a long time, can develop a neuropathy in the GI tract where they can no longer control the mobility of their stool and will end up on needing to be on chronic antidiuretic medications to control it. So it's very important to talk with your doctor, because losing fluid from the GI tract was also going to impact your electrolytes. So you can actually lose a lot of potassium that way, which may be a good thing, but not necessarily if you're losing other electrolytes that go along with it. So it's important for something like that to always, when there's a fluid imbalance, talk to your doctor or your caretakers about it. How to deal with dry, itchy skin. Generally, the underlying cause for most patients on dialysis is going to be the phosphorus level. If it's not phosphorus, then, and it could just be related to lack of humidity, you want to certainly find a moisturizer that can keep your skin well moisturized. Sometimes a vitamin E cream can help, but mostly just having a moisturizer. If you're constantly itching, you can also use a little bit of a benzoyl cream or calamine lotion. Those are things that can help, but oftentimes just making sure you get at the cause of the itch. Maybe you may need to see a dermatologist to make sure that it's not a side effect of something you're taking or even some of your medications. So sometimes you require a deeper dive into the cause of those itching, the cause of the itching. Question: many patients complain that after dialysis they feel terrible and weak. What can they do? If you're talking about hemodialysis, and generally for most patients it's in-center dialysis, it oftentimes can be related to your volume gains and the amount of volume that needs to be taken off. So if you are constantly at high gains, if you're gaining 5-7 kilos or 10 kilos, then you are going to need to take off a large volume. Now you've likely taken 2 days to put on that extra volume. If you're on a weekend, it may be 3 days. And now you're expecting to take off that critical volume all in 3 to 4 hours. That's kind of squeezing your body like really quickly. 72 hours versus 4 hours is not a fair exchange, because now you're trying to pull fluid that has accumulated in your tissues back into your intravascular volume and then take it out through the dialysate. What that does is that it makes your body feel like it's dehydrated, because now the volume has not quite left your tissues yet, but you've then depleted the volume out of your GI, out of your vascular system. And so you are therefore drier than you were the day before. In theory, your volume is less and your body is now in a weakened state, because now you feel like you're depleted of all this extra volume. So it is important. That's why daily dialysis is so much better, home dialysis, because you can regulate your volumes and you're dialyzing more often to be able to put yourself in a more homeostasis compared to every other day. So what can they do? Minimize your volume gains. The less you gain, the less you have to remove, and you would avoid those terrible feeling of now you're depleted, your blood pressure is low, you feel like you need to go home and drink a gallon of water because you're so thirsty, and you didn't feel like you need to put on the same volume that you just took off because you are now in a quote dehydration state. So that taking off that volume is necessary, but the rate at which it comes off is what leads to how you feel. How to fix that? Minimize your volume gains so that you're not working your body so hard. And just imagine if you feel that way, the effect that it's having on your heart, because now you've caused it to balloon up, and now you've pulled it off, and now it's trying to compensate because it can't get back to its normal because you've been stretched out for so long. So that's important to remember. Please talk about how one can be compliant on dialysis and transplantation. Oh, how do you be compliant? I mean, you know, the thing about going on dialysis and transplant is now you have a whole bunch of people telling you what to do. You were living your life, you were doing your own thing. Now you're sick, and everyone is telling you, you must do this, you can't do that, and you feel out of control. Many patients don't like that, and so you're under the auspices of someone else, and your lifeline is connected to your compliance. And that is often difficult for people to deal with, but you have to remember that this is all about how you live your life and what you want out of your life. And compliance is really about trying to keep you on track. And sometimes for many patients who refuse to go to dialysis when they don't feel well, it's about understanding why it's important to go to dialysis. Maybe they're depressed, or they're feeling hopeless. And oftentimes it takes a deeper dive to really motivate someone to say, I need to do this because this is about me, my survival, not my providers, not my caretakers. And so they have to be able to see that as their investment in their own selves. That compliance is necessary for you to do better and hopefully not stay on dialysis, but to be able to get on the transplant list. And to get on the transplant list, they want to know that you value life, that you value the importance of getting a transplant because you want to live a better life, and you want to be able to appreciate that gift that's been given to you. And so those are important keys to think about in terms of compliance. Doing it for yourself, not for someone else. I'm doing this because I need to do this because I see that there is something better at the end of the road. I see that I can survive. I see that I can hopefully one day get to walk my daughter down the aisle. I want to be able to see my kids graduate college or my grandkids. So you want to be able to have that hope for something better and then know that dialysis is not the end of the road. What are some cold weather precautions end-stage renal disease patients should take? Cold weather all the time. I say in terms of, we know that you want to make sure that as we go into the cold weather, we are in close quarters with a lot of folks. And unfortunately, as a healthcare provider, I'm seeing a lot of flu and COVID. So as far as being on dialysis, you are with end-stage kidney disease or even after transplant, you are more immunocompromised than your average person. And so your immune system oftentimes is weaker and not able to fight, and your antibodies are not as strong. And so it's important to make sure that if you're going out to church or you're going out with your groups or you're going to the movies, wear a mask, be conscious of surfaces. There's also a lot of GI bugs going around. So bathroom handles, doorknobs, take your wipes with you. Not saying you need to wear gloves, but be conscious take your hand wipes, hand sanitizer, try to keep your hands from your face. And that's why it's so important to wear a face mask because it keeps you from touching your nose as it gets colder, wiping if your tears are running down your eyes, that sort of thing. Wear a mask, use hand sanitizers as often as you can, And if you know someone is sick in your circle, try to stay away from them. And I think that's so important. And if you have been vaccinated in the past against COVID and you had your flu vaccine, doesn't necessarily mean that you will not catch the virus, but it does offer you a better chance because hopefully you have developed some antibodies by getting vaccinated, and therefore you have armed yourself with some of a fighting defense that will help you fight off that cold, flu, or COVID. If you do get infected, make sure you call your healthcare provider because it's important. There are medications out there for the flu as well as for COVID. In terms of, as long as you don't have any contraindications, you want to be able to get started within the first 3 days with your antiviral treatment. So let your healthcare provider know. They're calling some medication to your pharmacy, and hopefully you can have someone pick it up for you to keep you from being out there. Question, how can we increase our chances of getting a transplant? Certainly, depending on where you live, depending on the list. Some lists are takes many years to get a call, and there are others who you can probably get called in 2 to 3 years. And so you want to look at what are your options to multi-list. There's always that, but it does involve going to another center, and it involves money and it involves transportation. But maybe if you have a relative or a family member or someone who is willing to allow you to be there during that time, so you have a place to stay and you have transportation, you can increase your chances of getting listed by multi-listing. You also want to make sure that if you're thinking about getting on the list, that you go ahead and have your primary care initiate all your health maintenance stuff first. Have you had your colonoscopy? And all this is by age. Have you had your prostate cancer screen, mammogram, pap smear? All the necessary dental clearance can hold people up for quite a long time. If you are diabetic and have heart disease, you want to make sure your cardiologists have done the appropriate stress tests, echocardiogram, so that you have those armed with those going into your transplants workup, so that you say, okay, A, B, C, D, I have done all these things and I can be a little further along, which eliminates my waiting time. Better yet, find a living donor. Doesn't have to be a relative, doesn't even have to be your same blood type. All it has to be is someone who's willing to donate and is compatible. Compatible doesn't necessarily mean the same blood type, but it does mean that that person giving you the kidney, that you have not developed any antibodies against that potential donor, and those antibodies can come from previous blood transfusion, prior transplant, and you can be tested for that. Can be a perfectly a stranger from your church, from your bingo club, from your book club, as long as they are committed to the cause, and we will evaluate them to make sure that they are appropriate donors, that they have 2 kidneys, they have to have 2, and that by donating, we don't put them at risk for kidney disease by donating one. So you want to know by taking away 1 kidney that they will have adequate kidney function with their remaining kidney. Does the cold weather affect your heart if you have end-stage renal disease? Not really. I would have to say, does it affect your heart overall? Depending, you don't want to jeopardize your body temperature because you want to maintain your body temperature. You know that if you drop your body temperature, then you're going to have issues with oxygenation, decreased metabolism, and perhaps decreased heart function. So overall, you want to make sure that you stay warm, you bundle up, you put your layers on, but no particular issue with having end-stage kidney disease. It all has to do with your underlying heart disease. If you have arrhythmias or AFib or other things that may be triggered by cold, that has to do with your underlying heart disease. So you may want to make sure, and nobody wants to be out in the cold for long periods of time, and you really shouldn't be, regardless of whether you have end-stage kidney disease or not. So may not be a 100% answer, but I do think that you want to protect your heart if you're aware of underlying heart disease that are such as an arrhythmia that could be triggered. What are your thoughts on fistula versus tunnel catheter? Certainly you want to have a fistula because it's more natural and less chances of infection, but not everyone have great veins to be able to get a fistula. And so the goal really is to take your vein and turn it into an arterialized pathway back up so you can use something that's natural. It does take time, and you want to have that be your first option. When you go to get evaluated, the vascular surgeon will always check to do a vein mapping to see if you have veins that will be amenable to a fistula. Generally in your hand or your forearm, better way to go. A catheter is an artificial substance that's tunneled into your body. Some people get infections and can be more problematic than fistulas because you put in needles into it every single couple days a week, and every time you introduce something into a foreign substance, you run the risk of possibility of infection. And you don't have, while your vein is more natural, your body can fight that because it's natural tissue. Your blood is able, your own body chemistry can take care of your natural vein, but the artificial tunnel catheter is going to be, if you're talking about a tunnel catheter in your neck, that's absolutely no, because any tunnel catheters will slowly build up debris in that vein, and eventually that vein will become useless. And because it will become blocked, and your body will have to find a different way of getting that blood back to your heart. Some people end up with varicosities. When you get to have a transplant or you have an emergency, there's no vein there's no space to be able to put a catheter in during an emergency or even for transplant. So you don't want to, these are big veins that go into your heart. And so when you have tunnel catheters up there, when they stay too long, you've now compromised the lumen of your blood vessel, which may go from being the size of a straw to being the size of the cord of your light. And so now you have minimum passageway, and I do not recommend. It's easier. People say, I don't want to get stuck, but no, not a way to go. Not the way to go. Dialysis affects my sleep. Can I use sleeping pills? Depends on your underlying issues. If you have sleep apnea, other conditions, you have to talk those over with your doctor because it's hard to know why you're not sleeping. Maybe you do have sleep apnea. Maybe you're not sleeping well because of that. So those are things that your primary care or your dialysis or your nephrologist can discuss with you, but it all depends on what other medications you're taking, how old you are, and whether there are contraindications to taking sleep medication based on your other comorbidities. Does stage 3 kidney failure causes cramps like Charlie horses? Shouldn't really be, because you still have relatively normal electrolytes at that point, but you want to make sure that your magnesium levels are appropriate, that your vitamin D levels are good, and so those are things you can have your doctor check to make sure that they're not any things that need to be corrected, and that you're not dehydrated also, which can also contribute to that. So we are at the magic hour of 4:30. I thank you all for being here and for joining us here at Dialysis Patient Citizens Educational Center for this Ask the Doctor session. And I am Dr. Velma Scantlebury. Have a wonderful day. God bless. Stay safe. And we will see you next month. Take care.